So, ladies and gentlemen, the very first award of this day is for the leading healthcare professional of the year, Pediatric Hematology, Oncology, and Bone Marrow Transplant, and it goes to Dr. Sunil Bhat. Well, Dr. Sunil Bhat is a consultant in Pediatric Hematology, Oncology, and Bone Marrow Transplant service at Mazumdar-Shaw Cancer Center of Narayana, Healthcare City. Thank you so very much, sir, and big congratulations, ladies and gentlemen. Round of applause for him, everyone. And ma'am, I would request you also to please join us. Yeah, please. I believe they are your parents, right? Round of applause, everyone. Congratulations to uncle and auntie. And sir, before you go, please say a few words. How do you feel about this award?
Morning everyone, and it's indeed a pleasure. I come from Bangalore and I work with Narayana Health City Bangalore, and it's indeed a pleasure to be here, especially with Mr. Madan Lal. My son wants to be a cricketer. He breathes and lives cricket. He's just 8-year-old at the moment. It's been quite interesting days, I think, in healthcare these days. I think we are at a brink, at a verge of a revolution, I should say. We hear and read a lot of stories about us and healthcare. What I want to say today is that let's keep the profession going. Let's keep the nobility of the profession going. Let's dedicate ourselves to the patient care. Let compassion be our password, and let's put ourselves in the I would say in the feet of patients and their families and what they go through. Once we understand that, I think we'll be good doctors, good human beings, and we can make the difference in the society. So, guys, don't lose heart. I think if we dedicate ourselves the way we have been all these decades, we definitely would make a difference and make difference in the lives of so many people we touch every day. Thank you very much.
Thank you so very much. And sir, I have to tell you, your mother is smiling like anything. She is feeling so proud. Congratulations to you, and thank you so very much for joining us for this day as well. Thank you.
The incidence of childhood cancer is not much. When we compare with adults, it's like 5% as compared to adults. But still, as we are getting control of other diseases which are preventable, infectious diseases, we see more and more of malignancies in cancers in children diagnosed. I think we are diagnosing more. I don't think that we are, it's in the rise. I think we are the same as the Western world, but we are now diagnosing more and more. Most of the times, the cause of cancer in children is not known. It's not like in adults, wherein we know that there is lifestyle changes like alcohol, smoking, dietary changes which give rise to cancers in adults. But in children, most of the times these lifestyle factors really do not play a role at all. So more than 95% of the times there is no cause. But in a small percentage of the cases, there may be some cause which may be environmental, or very rarely there can be genetic cause, where some genetic defect is there in the child or the family, and they can have higher chances of malignancy. What is the difference between adult and pediatric cancer? Lots of differences. One of the major differences in adult and pediatric cancer is that cancers in childhood can be cured, and 75% of the cancers in children can be cured. And when I use the word cure, it means cure forever. The other difference is that most of the times the cancers in children are very, very chemosensitive. That means they respond to chemotherapy very well. And because of that, response to chemotherapy, which is excellent, they have good outcomes. We also have to keep in mind small things like these are growing, children are growing, their brain is growing, they are developing, they have got organs which are developing. So some of the considerations we have to take in mind when we treat them, so that they don't have any long-term effects because of the treatment. So a lot of blood disorders in children are there which are non-cancerous, and some of them can be really life-threatening, potentially life-threatening. The major ones which I can recall is some genetic disorders like sickle cell anemia, like thalassemia. So these are blood disorders which are inherited from the parents, and we are the thalassemia capital of the world. We have the majority of thalassemics born in our country. Then the other group of disorders in children is, we call them bone marrow failure syndromes, like aplastic anemia. That means the bone marrow fails to produce blood. It's relatively common in children as well. The third disorder, which is again common but we were not able to identify these disorders earlier, are immunodeficiency disorders. That means the children born with immune deficiencies, and these children succumb, they die because of infections and very early on in their life. So this is another group of disorders which we come across in children. They are non-cancerous but have potentially life-threatening implications. So thalassemia is a genetic disorder. It's a defect in the hemoglobin production, that is the blood production. So these children are dependent on lifelong blood transfusion. So they receive blood transfusion every 3 to 4 weeks throughout their life, and that has got its own problems, which are like infections because of blood, and also because of the blood they're getting every 3 to 4 weeks. They have risk of what called as iron overload. They get a lot of iron deposit in their body. So we, as I said earlier, we are the thalassemia capital of the world. We have the majority of the children in world born with thalassemia are born in India. We have around 20,000 children born with thalassemia every year, and we are adding that every year to our pool. So it's a big problem in India. Thalassemia is preventable. So as I said, it's a genetic disorder. Both the parents are carriers of this gene. That means they have one gene which is abnormal, other gene is normal. And because of that, they are not affected by in any way. They lead a normal life. So most of the times people do not know that they are thalassemia carriers. But when two parents who have thalassemia, they marry and they have a child, there's a potential risk that the child may have thalassemia major and they may be affected with thalassemia. So the easiest way to prevent is to know, the couple should know that they are having thalassemia carrier state. And that's only possible when we have a widespread, countrywide, nationwide drive to know the carrier state of each and every individual. And when they marry, either they can do what's called as pre-marriage counseling. That means they may not marry, or if they marry, then they need to do a simple test at 10 to 12 weeks of pregnancy to identify that the child doesn't have thalassemia major. So there are ways to prevent it, but we need to, I think, educate and have a national policy about it. Bone marrow transplant is a potentially potential treatment option for a lot of conditions. And what happens in bone marrow transplant is that you replace the bone marrow of the patient with a donor's bone marrow, or sometimes we take the stem cells of the patient himself and give it back to him after treatment has been given. So that's called, the first one is called autologous transplant, wherein you take the stem cells of the patient, give it back to the patient. The second is called allogenic, that means take the stem cells of a donor who's a healthy donor and give it to the patient. Both these situations are used to treat potentially life-threatening indications like cancers, like leukemia, blood cancer. So you can be treated with bone marrow transplant. A lot of genetic disorders which can be treated with bone marrow transplantation, like sickle cell, thalassemia, immunodeficiencies, aplastic anemias. A lot of these conditions which don't have other potential treatment option can be cured with bone marrow transplant. We can cure both malignant, that means cancerous, and non-cancerous conditions with bone marrow transplantation. And I think I listed the disease already, so that there are a lot of hundreds of disorders which can be cured, but it's mainly leukemias, blood cancers. It is thalassemia, sickle cell disease, aplastic anemia, immunodeficiencies. These are potential disorders which can be cured with bone marrow transplant. There's something called as HLA matching in bone marrow transplantation. That means you need to match the patient and the donor who can donate for this patient. Okay, now for the matching, which doesn't apply for solid organ transplants like liver, kidney. You don't need to match the patient and the donor on HLA type. We just need to match them on a blood group. But on bone marrow transplantation, you need to match the patient and the donor on what's called as HLA typing. And that's why it becomes important to test the patient and the donor for this HLA type, and we need to ensure their matching. And this chances of a brother or sister matching is about 30%. If brother-sister doesn't match, then we can search for a matching donor for this patient elsewhere in the country, abroad, anywhere in the world, and see whether anyone in the world is matching this patient. In India, I think for the last few years, there's been a lot of progress being made in the field of bone marrow transplantation. So I think we used to just read about it in our textbooks, but now it's a reality. A lot of centers in India have, in the last few years, made this treatment option available to a lot of patients in India. First time in India in 2017, that's last year, more than 2,000 transplants have been done all over the country, of course, and the numbers are increasing. Although, having said that, the numbers which we are doing at the moment is probably not as adequate as what we expect to do. We expect around 2 lakh transplants to be done in India every year. We are just doing 2,000 or 3,000, but I think this progress been made, and we are also able to improve the quality of care and let the outcomes of transplant improve in the last few years. So better, with better facilities, with better supportive care, the outcomes, the results of the transplant are improving. So that's another change which has happened in the last few years, and I think it's exciting times. So in future we'll be seeing more and more of this happening, more and more children and more patients being cured with bone marrow transplant in India as well.